The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. My name is Tyra Nixon. I'm calling from the Healthcare Authority. This webinar today is about the Tribal MAC RMTS program updates for the public health emergency that we've been communicating to you about over the past couple of days. Today, we want to be able to share some updates with you concerning the cost allocation plan. In the meantime, while this is going on, we want to make sure that everyone is able to hear us. And if you would be so kind to go over to the questions or chat feature in the webinar control panel to let us know that you can hear and see the screen. Also, throughout the presentation, if you happen to have any questions, feel free to put it into the questions or chat feature, and we'll be able to answer those on the way. Also, at the end of the presentation, we'll be able to open it up for questions. And with that said, we're just going to move on here. Again, my name is Tyra Nixon, Program Manager for Tribal Medicaid Administrative Claiming, and with me on this presentation is Laura Pierpoint. She's Program Manager here at Healthcare Authority as well for our MTS administration. Today's objectives, a few things that we want to go over. Number one, we're going to talk about Tribal MAC program updates concerning the public health emergency or the pandemic. We're going to talk about answering random moments during this public health emergency. We're going to talk about narratives, the random moment time study response time, the reimbursement process, staff outside of the RMTS and documentation, important deadlines. We're going to have some MAC resources, and again, open it up for questions. With that said, looking over into our chat and our questions, it looks like everyone can see us and can hear us. Great, thanks everyone. Today, we're going to talk about the public health emergency for COVID-19. Over the past couple of days, as most of you are now aware, we submitted a cost allocation plan amendment to CMS. What we wanted to do is to temporarily amend the current cost allocation plan to include or to extend public health related activities. And those activities are surveillance, health education, data reporting, and infection control. And I'll say that again, we wanted to temporarily amend the current cost allocation plan to include public health related activities, the COVID-19 public health related activities, and those activities, surveillance, health education, data reporting, and infection control. So what is new with the amendment? A few things that we want to bring to your attention. Staff activities must be related to the public health emergency. You see that in red on the PowerPoint here. There have been new responses added to the first question. And as you know, the first question is, what type of activity were you doing? So some new responses have been added as drop downs to that first question. So the drop down selections will begin with public health emergency, and we're going to see an example of that in just a moment. Again, the drop down selection will begin with public health emergency for that first question, and they will look something similar to this. This right here should be familiar to everyone. What type of activity were you doing? With that question, as you're aware, you already see there's a time off, not at work, including vacation, break, sick leave, lunch, not scheduled, flexible schedule, drop down response. Also, there's a direct medical services activity response. There's a response or drop down for financial counseling and claims processing. Also, there's a response for case management or social work You see those in the upper part of the drop-down responses. What's going to be new if you redirect your attention toward the bottom or the middle to the bottom? You will see the responses now that will mirror similar to what we're already used to doing, but this time this will have a public health emergency in front of it. So the new responses will be public health emergency, direct medical services activities, public health emergencies for financial counseling and claims processing, public health emergency for case management or social work. Also, you'll see public health emergency outreach application assistance, public health emergency coordinating or referring for services. You'll see that as well for transportation, training, program planning, and policy development. And you'll see a couple of other ones where it says required surveillance and or reporting to state or the CDC. Centers for Disease Control, you will see that listed here as your options for answering question number 1. Okay, now that that has been added, a couple of things that we really still want to stress to everyone. Make sure that staff are explaining their work activities when they get ready to do their documentation. So for the narrative portion and documentation, staff must explain how work activities are related to the public health emergency. Just as before, we want to document the activities and making sure that our work activities are related to the drop downs or the work that we are doing. The same applies here for the public health emergency. And also, please remember, no confidential information. Please, no names, no social security numbers, or any sort of confidential information. I know that there are some tribes that use different sort of markers or identifiers um, for their clients, which is still fine. These are made up or fictitious numbers and things like that that are that go directly or are tied to a client. That is fine. You can still continue to do what you're doing, but we just wanted to stress this part, making sure that no information is confidential. Again, social security numbers and names. Um, Another reminder, remote ability for answering moments. Staff can answer moments from any internet-enabled device, such as your mobile phones and tablets. And this is a good place to stop right here. I did send out some information earlier today and also yesterday. There were some supporting documents that you have about mobile instructions, and also there was a quick reference guide to explain a little bit more about what we are or what we were going to present for today. Also, this presentation we're going to put out online for you to go back and have a chance to review. So again, the reminder is there is a remote ability for answering moments. Right now, we understand and we know that because of the pandemic that is occurring, quite a few people are working remotely. A lot of folks are working from home. From what I'm understanding and what I'm seeing from the reports back from our contractors, from you, people are or do have the ability to get to their workplace emails, which is great because the moments are still coming through. And I understand that there were a few people that could not get into the system because they didn't have their passwords and everything. However, the University of Massachusetts was able to send those password resets and user IDs to individuals so that they can get into this to the system, which is great. But just a reminder for everyone, even if you can't get to your email, or if you can't get to your workplace computer, remember, if you have a mobile phone, tablets, things that are web-based, definitely you still can get inside the system and answer your moments. Thank you. Right now, I just want to pause for a quick moment to see if we have any questions in our questions log or chat. And so far, so good. Okay. The next slide, response time for our MTS moments. What's new? Another thing that's new for the cost allocation plan amendment was that that we have a response time for answering our moments, which was 5 days. The 5 day grace period to answer your moment once you receive a moment. I want to report today that those 5 work days are now 15 work days. I'm going to say that again. 5 work days is now 15 work days. That means staff have 15 days to answer their moments, which is really good to help in the situations, the pandemic is causing. Quite a few people are busy. Things are moving pretty fast out there and changing pretty fast. So this will give people more ample time to answer their moments. So a few notes about this. As you know, the RMTS gives you a notification and also give you a reminder. This is one of the fail safes that we have in the system because, life happens. If one of the staff members gets in a moment, they may not answer it right away. It may take a day or two, and the system, so that we are making sure that we are in compliance, that we're answering 85% of all of our moments. When a moment goes unanswered, reminder notices either go to the MAC coordinator or the supervisor. That still applies. And so let me just lay out the new timeline as to how that works. Right now, our MTS email notification is going to come to the staff member or the participant at the moment. The staff will receive another reminder 24 hours after the moment if it has not been answered. The next time, 72 hours after the moment. After 72 hours, if the moment has not been answered, the staff person will get a reminder. The staff person will also receive a 5 day reminder. 5 days after the moment, if there's been no response to that moment, a reminder will go out. 10 days, however, after the moment, and still no action on the moment, a copy or a reminder will go to the supervisor and the MAC coordinator or whoever you have designated for those messages to go to, those reminder notices to go to. So either the supervisor and or the MAC coordinator will get the reminders starting 10 days after an email notification at the moment. Our MTS at the moment request has gone out. You will receive one 10 days after. Also, supervisors and MAC coordinators, 48 hours before the moment expires, you will also receive another reminder letting you know that your staff has not made any action or has not answered that moment. And so this is really, really important because, as you know, if moments go unanswered, they are invalid and may jeopardize the statistical validity of the RMTS and reimbursement. And we don't want that to happen. So up to what I've been telling you so far, everything in the systems, the warnings, the reports, the reminders, and all of those sorts of functions are still the same, So you'll be able to go out there and look at your reports as to who's answering moments, who has not taken any action. Your reports are still there. Also, when in the system, you have the ability to go in there and edit your moment. If you made a mistake or you realize later that you've made a mistake in answering a moment, you still have that grace period. That still applies. So this time, instead of 5 days, it's 15 days. If the staff realize that they made a mistake or something needs to be changed, they still have that window, 15 days, to go into the system and change their moments or their response. After the 15 days, those moments will be considered expired. So please make sure that you're reminding your staff that if moments go unanswered, they are invalid and could jeopardize the validity of the RMTS and the reimbursement. At this moment, I'm going to take a second or two just to look in the questions in chat. And so far, so good. Okay, good. I'm glad everyone's able to see and hear and comprehend what's happening. Okay, great. The next thing that we want to talk about is claiming. There are two things on this page that I want to pull out. Number one, backcasting, and it's not going to be called backcasting. I'm going to change this PowerPoint, and I'm going to put it out on the website, on our Mac website. But we're not going to call it backcasting. We're just going to call it resetting. So the ideal of it is that we want to compensate or make sure that the tribes are reimbursed for the work that perhaps staff have already completed during the time the state of emergency took place. So the quarter, as you know, started January through March, but it could be that tribes or staff have already been doing some work that was part of the pandemic, and they probably captured that information inside of the system, or maybe they did not capture that activity inside of the system, especially in the narratives. But what we wanted to let everyone know is that what we're going to do is be able to go back after this quarter, after the January through March quarter has been completed. We're going to be able to go back and make sure that tribes get credit and reimbursement for the time that they spent on COVID-19 activities. And this is how we're looking that this is going to work. So allocation comparison of the January through March 2020 quarter is going to be done with the April through June 2020 quarter. Okay, so one of the things I want you to make note of this, that you will not be able to claim your January through March on its normal schedule. We have to wait until the April through June 2020 quarter has been completed. And so we're looking sometime around the end of July, early August, that we should have everything wrapped up. And so we will be able to compare the two quarters and make the allocations comparison so that we can be able to get those activities that were COVID-19 prepared so that you can be able to claim for that. Okay. And so one other thing with this, the MER applied to the there will be no MER, I should say, applied to the public health emergency activities. All COVID-19 activities will be reimbursed at the 50% FFP. Sorry about that. Let me start that again. All COVID-19 activities will be reimbursed at the 50% FFP, and the MER will not be applied. Okay, so those are some other updates to the cost allocation plan. So the second part of this is Friday or last week, we had opened up the RMTS for folks to put new participants into the RMTS, especially those that have not participated in the RMTS before. And I think everyone except for maybe two tribes that did not get their new people in. These folks are new staff that perhaps have been working on the pandemic related activities. And so last week we wanted to open the participants list up so you can add those folks in. But I just want everyone to know, staff who are not a part of the RMTS during when the state of emergency started, either when the tribes declared it as a state of emergency or, Washington State, whenever that started, staff who were not a part of the RMTS for those pandemic related activities, tribes are going to be able to bill healthcare authority directly for those activities. Okay, so we got two things going on. Number one, there were staff who were already in the system. That's how we're going to make sure that tribes get reimbursed for that, is that we're going to be doing the backcasting or resetting uh, um, procedure in order for tribes to get reimbursed, and also staff who were not a part of the RMTS during the state of emergency start date from until it's over with, you're going to be able to back, or I should say, you're going to be able to get billed HCA directly for those activities. So what we're asking tribes to do is to make sure that they track and document the time spent on COVID-19 activities. Whatever internal methods that you have on your own, make sure that tribes are um, tracking and documenting the time spent on activities, and then you will be able to submit the billing or your work to HCA. To HCA, you'll be able to directly bill HCA for those activities. Okay, and again, this time as well, all COVID-19 activities will be reimbursed at the 50% FFP, and the MER will not be applied. So we got two things going on. Let me repeat that one more time. There are staff that are already in the RMTS. So those staff that were already in the RMTS, that's great. What we're going to do is be able to backcast or do resetting to make sure that folks who did have COVID-related 19 activities, we're going to make sure that the tribes get billed, reimbursed appropriately for that work. However, in order to do that, we have to do a comparison. So we have to compare April through June with January through March to make that allocation comparison so that we can do the appropriate reimbursement to get reimbursement back to the tribes. And secondly, there were those staff who were not a part of the RMTS during this time. What we want to do is make sure that tribes, you are track and document that time, and you will be able to directly bill HCA for those activities. And so also another part is open, as you know, that April 1st is coming around the corner real quickly here. The new quarter is going to begin. So we opened up the RMTS for you to go ahead and add new people in for the April through June quarter. Okay. One last piece on that. If anybody have any questions, feel free to ask. Or if you don't have a question right now, at the end of this or later on something come up, you can still email me, and I'm going to take your question and add it to a working question and answer page that we can put out on the web as well. So one last thing about the claiming portion, and I'm looking over in our questions and chat. Okay, anybody have any questions? Okay, so far so good. Okay, good. All program rules and for claiming and revenue offset will remain the same. Okay, and let me repeat that. All program rules for claiming and revenue offset will remain the same. Okay, so again, with the claiming revenue offsets procedures and activities still being the same, again, let me remind you that all of the RMTS functions are still the same. Again, like I said, reports are still available. How you answer your moments are still the same. Nothing overall for the methodology or for the way that we do the RMTS, everything is still the same. But a couple of reminders. One of the ways to look at this is the activity public health emergency COVID-19 related. You may want to start that question, because one thing I want you to stress with your staff is document, document, document. That narrative box that's there is going to be very important. If the answer to the question is the activity that you're doing public health emergency related, if it's yes, then use the new drop downs and document your activities accordingly. Use the new drop down. But if it's not part of or has anything to do with the public health emergency, then you can use the normal drop downs as normal or as business as usual, and still make sure that you document your activities. So some important deadlines are coming up: May 31st, June 10th, and July 1. May 31st is the due date for general tribal calendar deadlines. This is the day that we've been using traditionally over the past several years. May 31st looked like it was the universal day where all tribes know their schedules for the upcoming year, and those calendars have been published. So please, when you have your general tribal calendar, please go ahead and put it in as soon as possible, because when June 10th comes around, your new participants list and schedules are due. The participants list is going to be for July through September. July through September, it will be here before we know it. However, before you can do your participants list and schedule for June 10th, your general tribal calendar has to be into the system. Otherwise, the June 10th one is not going to work. So please, if you have your general calendar, if your general calendar comes out in April, by all means, please go into the system and update the general calendar, including all of your tribal specific holidays, your tribe regular holidays, any special time off that's going to be for the tribes. Please go ahead and put that information in. Once that is in, then you can go in and put your participants list and schedule in. That's very, very important. And of course, July 1st, the new RMTS year for 2021 begins. Okay, so again, the new year is approaching pretty quick. RMTS for 2021 begins on the 1st, and make sure that you update first your main tribal calendar. Okay, also with this, I want to have everyone please take action as soon as possible. Well, right now, all of the things that are happening are so fast and furious in everyone's office. Everyone is very busy and the times are uncertain, and we don't want to wait to the last moment, at June 10th at 4:50 p.m. For you to be adding in your participants list or requesting technical assistance, because everyone's using Skype, everyone's using platforms like webinar, Zoom, the phones, everything is being used right now. So, and I know sometimes technology can be delayed or cause a delay, and we don't want that to happen right at the time where everything is is due. So please, once you get your information, as soon as April 1st comes, if you know everything about your general calendar, you have your new hires, you know who's going to be working in your tribe, by all means, you can start putting that information into the system right away. But the main takeaway here is that your general calendar, your general tribal calendar has to be in first before you can put your participants list in. Alrighty? And this would be a good time to stop for questions. Okay, nothing there yet? Okay, good. Okay, moving on. Another part of the important deadlines, Healthcare Authority is still open for business, even though we're working remotely and we've changed like everyone else has changed. Lobbies have to be closed down, and we're practicing social distancing and everything, but Healthcare Authority is still open for business otherwise. And so with that said, Healthcare Authority is still processing claims during this emergency time. So claims for October through December 2020 are due April 30th of 2020. And thank you for those tribes. I know we've received a few claims already. So thank you for getting your information in. But we want to make sure that everyone knows that we're still open for business. Again, claims for January and March 2020, the quarter that's getting ready to end tomorrow, March 31st. Those claims, this January through March claims, these claims, I should say, will not be available until after the April through June quarter is closed. We need the results for our backcasting or resetting, okay? So again, we expect results by the end of July or early August, but as usual, we'll keep everyone informed as to where we are with that. Here's some resources for you. Some of you will already have these items. Please make sure that you're utilizing the Healthcare Authority Program MAC website. You find all of your resources there. You're going to find the recent CAP amendment there. There are a variety of other things there for you as well to look at. These resources here, training resources for your staff will be on that page. Most of you are already familiar with the CMS School-Based Administrative Claiming Guide. Here's a website there. And a couple of other things for the University of Massachusetts. You see, well, the Random Moment Times, the Random Moment System website is there, the www.chcf.net. But to talk about a couple of things with UMass for claiming, you see the website there that is still available. For answering moments, you see the website there that is still available. And for our MTS administration, I wanted to let you know that the University of Massachusetts folks are going through the same thing that Washington State is. They're working remotely as well. So reaching them by phone might be a little difficult. However, the website is still there for the help desk. So if you need technical assistance on resetting passwords, if you need technical assistance for participants list, calendars, claiming, they are your first line of defense, if you would. They have their help desk open and staffed, and they're ready to help Washington State with any issue that come up or any type of technical assistance that may be needed. They are fully operational, but again, they're working remotely as well. So the quickest way that a participant or that you can reach them is that last RMTS, or the participants can quickly be reached or can quickly use. You see where it says RMTS help UMass. If you would put an email into that site, letting them know what's going on, they should be able to get back to you right away. And if you need to leave a phone number, probably not, but if you do, that will be the area where you leave information so they can get back to you as quickly as possible. Okay? In the meantime, I'm Tyra Nixon, as you all are aware. I'm still here. I'm working remotely as well, moving fast and furious, as I said earlier, as we all are. But we're still here to answer any questions and make sure that we're getting things and out to you. Trainings, I know come April 1st, we have all of the new staff that have joined MAC. We're going to be doing a training for them come Wednesday morning. And so we're going to be facilitating that. But feel free to reach out to me at my email, phone call. We'll try to get back to you just as soon as we can. And also, the staff over in MAC, one of which is Laura. She's there. We have a great team there of folks working on school districts. They have their part of MAC. We have the local health jurisdictions, the King County Superior Court, juvenile probation services. So we're all there as a team. And so we're manning the phones and getting messages out to each other about any issues that folks in the field may be experiencing. So I'm still there. And right now, it doesn't look like we have any questions, which is great. I'm glad you guys got the information. But again, feel free to reach out to me later on if you happen to get a question that may come up with this pandemic that is going on. We're going to try to be there immediately to help you out. And we'll take a moment or two. If there won't be any other questions, I want to say I thank you for your time. You guys have been great partners through this. And so we just want to make sure that everyone is safe. So God bless, and make sure you keep yourself safe and all of those kind of good things. And we will talk to you soon. Thank you. Bye-bye.